Mitochondrial myopathies. The main symptoms of mitochondrial myopathies are muscle weakness and atrophy, shrinking, and exercise intolerance. Sometimes people with mitochondrial myopathies experience loss of muscle strength in their arms or legs. These diseases also can cause significant weakness in the muscles that support breathing. The build-up of lactic acid in the blood, called lactic acidosis, is associated with muscle fatigue and might damage muscle and nerve tissue. Muscle and nerve cells use ATP derived from mitochondria as their main source of energy.
دكتور أحمد, شنو يعني what are the categories that muscular diseases go into, like some of them, what are they?
The most important categories are the genetic, inflammatory, autoimmune, and injury.
So, like, what are some of the names of these certain diseases?
If we're talking about injuries, you have the sprains and cramps. You can have autoimmune such as gravis, myasthenia gravis. You can have the Duchenne with the paralysis, and it's a genetic disease. There is a very long list of diseases into these categories.
What are the most common types of diseases affecting the muscular system?
Of course, the injuries. We are facing injuries every day. Sprains, strains, and cramps we are getting every day.
And how can we prevent some of these diseases, and what are ones that can be prevented?
Actually, the genetic and the autoimmune is very difficult to prevent because if it's in the gene, and usually the X chromosome can carry some abnormality that can cause the disease. So it is something that we cannot prevent. Autoimmune also we cannot predict or prevent. But for injuries like strains and cramps, yes. With warm-ups before exercise, daily exercise, and stretching, we can prevent most of these injuries.
And have you ever experienced a patient that has come to you with a muscular disease?
Of course. I've seen more than one patient. Patients with
is it common, like
flaccid paralysis? It's not. The flaccid paralysis is not common. Actually, in Kuwait, we are very happy to say that we don't have any new cases of flaccid paralysis. But other weaknesses and Graves' disease, yes, I've seen a lot of patients with strains and cramps and strains, yes.
And the last question is, can these diseases on the muscular system affect like other systems, like maybe a disease, an injury can affect something in the skeletal system or anything?
Yes, if there is a prolonged injury for a muscle, it can cause some deformity to the bone that it's attached to, and can change the shape of the bone if it's a chronic disease. And this is regarding the muscles attached to the bones and the skeleton.